I'm Garrison Smith, and this is my persuasive speech on why anorexia nervosa should be the Centers for Disease Control and Prevention's next video ad campaign. Anorexia nervosa, better known as anorexia, is harming teens in America at a very alarming rate. And hopefully by the end of this speech, my audience should be able to believe in my push for anorexia to be the next focus for the video health campaign. My audience will understand the urgency to help anorexia and how much it actually affects teens in our society. And hopefully it will change the behavior of some children across the nation, basically teenage girls. I feel that I am qualified to talk about this topic because of my inside knowledge of people with anorexia, and I've been dealing with anorexia in people for about a year and a half now. So I've been researching it and just been surrounded by people with anorexia. So I've kind of got the inside scoop on that, you could say. My main points of why I think anorexia nervosa should be an important topic to cover for the video, for the campaign, is how hard it is to prevent and deal with anorexia, how common it is, and how the disease actually affects the patient's body and the side effects of that. So, anorexia is actually a very common thing for families to deal with, more common than you would think. About 1% of all women at any age will be affected by this disease in their lifetime in the United States. So that means millions of women will be affected by this at least one stage in their life. Family, however, dealing with this sort of disease can be affected in many ways due to the fact that the majority of the people who are affected are teenagers, and obviously they can't really they can't take care of themselves, so their family has to take their time, use their money at different clinics, different health centers specified for anorexia. And yeah, just the teens can't do stuff for themselves most of the time, so the family is very, very involved in the whole process of taking care of them. Anorexia can go unnoticed for a long amount of time. A lot of families go probably 4 or 5 months before actually realizing, like, wow, this is really unhealthy. They think that they may have started cutting down on their eating, but it's never a good thing in teenagers, because teens are supposed to be eating more and more as they grow up. So a lot of families just think it's a natural thing. They don't know about anorexia. That's also another reason I think that it should definitely be a center for the video ad campaign, so it gets more attention that way, because families just miss it. It flies over their head. Another reason I think that anorexia nervosa should be the next video ad campaign is just how harsh it is to deal and prevent this disease. Most patients of anorexia must be taken to a clinic specified in helping eating disorders, which can be very costly. It's not just a physical disease, it's more of a mental capacity disease. It's more of a disorder than a disease, because it almost changes the person who has anorexia, and they even have to deal with different doctors, different physicians, different people that can help the people who have anorexia, because not only is it physical, it's definitely mental, and without the mental aspect of getting help, nothing would happen. Getting enough attention to this disease would prevent some of the cases in America if we caught it early, because like I said, a lot of the cases just go unnoticed, and that's what I try to be preventing by having it be the main center for the ad campaign. How bad anorexia is for the body of the patient should definitely be another reason that we should focus more on this disease. It strips the body of fat, and the body starts eating itself, the mind gets messed up, the person changes completely. Yeah, so nutrition loss, anorexia is number one thing. It focuses on the thing inside the person's head who has anorexia, tells them they don't need that nutrition, so they should just stop eating completely. But that's not good for the body. It starts eating itself because it has to survive somehow. And then the mind definitely has a lot to be dealt with. The mind of the patient definitely goes through a lot, probably more than the body does. Because especially in teens, whenever they're going through puberty and such, the outcome can just be unpredictable. A lot of times it's explosive behavior, and it's like you've never seen this person before. You can't really do anything about it, but it's definitely like they've changed. And it definitely affects how the person lives. There's different things that a person with anorexia does as they go through the stages of it. It's a long-term disease, and the behavior of anorexia in a body will constantly show up through their life. Just certain behavioral changes, and it affects their whole life. So basically, that's why I think that anorexia should be the next ad campaign. I think my speech should be able to convince my audience to believe that anorexia is a major disease. The way it affects the patient, their families, and just the ways you have to deal with anorexia, just the points I've made, should be able to sell my point. And I believe that anorexia is a disease that shouldn't go unnoticed any longer. And it's important for us to push for this to help the future of America. Thank you for listening.